Okay, so now let's talk about differential diagnosis for posterior fossa mass in adult in the brain, as it should be. Posterior fossa mass. So we need to think about mainly four masses in the posterior fossa. And as almost always in adults, when we're talking about cancer or lesions, we need to think about metastasis. And metastasis, it may be multiple. So remember, if there is a multiple lesions, it may be metastasis, not must be. You also have different things that can be numerous, but metastasis numerous is one key feature. Enhancing, and of course, look for the history of malignancy, as lung cancer, breast cancer. Look for malignancies. So this is the first one. And the second one is a hemangioblastom, as also can be seen in children, and we talked about it. So hemangioblastom, as we said, is the cystic lesion with enhancing molar noodle. Of course, this is not the only one. In children, you also have juvenile pilocystic astrocytoma. But here in hemangioblastom, you have this cystic lesion with enhancing molar noodle. This is the cystic part. This is the nodule. And note that it is molar on the wall, and it enhances with contrast. So T1 contrast enhanced MRI, it will enhance this molar nodule. Think about von Hippel-Lindau in those patients. Look for the floor voids that will help you differentiate it from the pilocystic astrocytoma. But this is the cystic mass with enhancing molar nodule in adults. The another one is the astrocytoma in the, of course, remember that we are talking about the posterior fossa. So astrocytoma, you will see minimal or little enhancement. This is one of the key features of astrocytoma. Another one is the medulloblastoma. Remember, the medulloblastoma is the most common posterior fossa brain tumor in pediatric population. And now when we are talking about adults, you need to think about, for the medulloblastoma, you need to think about young adult, and you need to think about lateral location in adults. Okay, so those are the main three differential diagnoses for posterior fossa mass lesion in adult. You need to think about metastasis, you need to think about hemangioblastom, astrocytoma, and medulloblastoma. Thank you very much. That's it.